Good afternoon. First of all, I again also want to thank all the members who are participating in this. And we're going to talk about behavioral health into the future. Next slide, please. There are many post-COVID challenges. Working with the member hospitals that you all do, you know them, you live those every day. But to name a few of the behavioral health specific challenges, we know that 40% of adults reported a significant behavioral health problem in a study that was done in June 2020. The prevalence of symptoms of specific anxiety disorders, depression, increased incredibly. Anxiety alone went up approximately 3 times from what was reported in 2019. We already talked about suicidal ideation and attempts with many of my colleagues. This is all being increased by the US behavioral health crisis, and it's fueling up to $140 billion in added spending and countless suffering. Tammy talked about children. Just today, this morning, I read a quote from Children's Hospital of Colorado, and they were reporting a 90% increase in demand of behavioral health treatment now compared to what it was. And they said there's many weeks where their number one emergency department visit is because of a suicide attempt. That is just staggering to even think about. There's many disruptions in care due to the pandemic. We're very well aware of that. Next slide, please. But let's get a little hopeful and talk about moving into the future. I think one of the really important things, and going back to talk about the members webinar that Vizient sponsored recently, and a lot of it was talking about rising up, I would encourage and challenge all of us, every member that's on the phone or other members that you work with in your organizations, to think and talk and make plans for how we can rise up as healthcare providers to do better. Number one, the conversation's happening. When you turn on the television and Oprah and Prince Harry are talking about pretty significant private mental health problems, that's a change for us in this country, and it's very positive. We really need to work to create a culture of support, really focus on whole person care. It's the right thing to do, but it's also the right thing financially, because we know that in a population that is seriously and persistently mentally ill, for those of your organizations, the member organizations that are in fact either dove in or dipping a toe into population health, we know that the biggest spend in that population is actually the medical spend. And so whole person care makes sense for all kinds of reasons. We've already touched on telehealth. There have been many changes in policy and payment, and changes in who can qualify and who can provide the services. Hopefully none of those dials get turned back again. There's an app now, it's incredible. It's called Brightside, and it's actually for consumers. And it is actually supposed to help manage your symptoms for anxiety and depression. There's been a 50% increase in new users from the early pandemic to now. That's great. We talked about policy changes. There's a lot happening, which is very exciting to me, working in the behavioral health field, which I care passionately about. One is 2 women wrote A Path Forward: Mental Health and the United States Pandemic Response. The 2 women are pretty incredible. One, Shirlane McCrae, is the First Lady of Washington, D.C., and Linda Rosenberg was a past president for the National Council on Behavioral Health. A lot of that was building on the Affordable Care Act and mental health parity and taking it further. Next slide, please. There's a lot of opportunities for all of us beyond healthcare providers and the members on this webinar. Employers, one study showed that 68% of employers plan to increase their emphasis on behavioral health within the next 2 years. So there was a defined period. That's fabulous. There's real opportunity for us to use population health affecting mental health policy to aim to really promote healing and wellness broadly for vulnerable populations. Next slide, please. Transformation of the data sharing environment. Huge opportunity there. I was mental health commissioner at one point in the state of Arkansas working on behavioral health reform. And one of the biggest things, and this is happening in every state in the country, was talking about the data sharing environment, because it's really hard to say you're going to have whole person care if the systems can't talk to each other. But there's a lot happening. California, for example, has published guidelines to promote effective sharing of behavioral health data. That's just one example. Other states are working on their data infrastructures as part of healthcare reform and patient-centered health homes. CMS and a lot of those have requirements, in fact, for a lot of that. Really empowering consumers. Stigma seems to finally be moving in a direction that's different. You know, we know that ages 26 and above, about 35% of that population is seeing some type of a behavioral health professional, while 18 to 25, very different generation, self-reported 60%. Next slide, please. There are huge technology opportunities. I'm just going to run through a few, but of course you can go in and research any of these. Virtual assistants. So there are chat bots. I didn't even know what a chat bot was when I started researching this, and emotion-based algorithms to provide psychological support directly to people. One is called Tess, and it's actually a mental health chat bot that provides coping strategies for people suffering with some kind of a behavioral health problem. There are digital consumer experience technologies. These are platforms that manage the patient relationship and monitor and exchange information between patients and caregivers, and then connect the patients to specific tools. One is called NeuroFlow, and it actually is a suite of tools that enables remote monitoring and behavioral health integration across continuums of care. There's all kinds of diagnostic support screening tools. One is called Unmind, and it's a workplace mental health platform that empowers organizations and employees to measurably change, whether it's their anxiety or how they're, feeling in another negative way. Next slide, please. Digital phenotyping. This is really customized treatment, monitoring, and clinical decisions for new biomarkers by wearable devices. One is called Abilify MySight, and it's actually a prescription of a tablet with an ingestible event marker sensor inside. I mean, it sounds real sci-fi, but these things are tools that are out there now. All kinds of neurological interventions. One is WVU Medicine, who I have to give a shout out. Our chief medical officer was the chief of psychiatry there. Not why I'm mentioning it, by the way. It's pretty cool. They have a clinical trial with deep brain stimulation for treatment-resistant opioid disorders. And we know that opioid disorders are extremely, extremely difficult to treat. Physical, augmented, and virtual reality. These are interventions with hyper-realistic environments. One is called a calm place. I mean, who couldn't use that sometimes at the end of a work week in healthcare through COVID? Next slide. So before I hand this over to Pat, I want to tell a very 2-minute story. And I think to me, it really is enough reason for all of us to rise up and to be that voice in our organizations, that champion, that really challenges, encourages all of us to think about how we can do better in behavioral health. There's a young woman named Lauren at the very, very, very beginning of COVID, back when it was March, and it was first starting to spread in a lot of the states. She had a toddler at home, a wonderful young husband, and had given birth in a very well-respected medical facility. And she was running a fever. And that was back, if all of you members remember, when it was really hard to even get your hands on a COVID test, even as a provider. I mean, we even had some units that had to close for a while as we thought and really struggled with how could we all get our hands on COVID tests. Anyway, so they assumed she had COVID because of the symptoms and sent her home without a COVID test. And she wound up passing away within 24 hours. And it turned out she didn't have COVID. She had a uterine infection that could have been treated. The tie to mental health here is her young husband isolated A lot of family was out of the country, and the few family that were here really couldn't have access to help him. And so here he was now with a toddler and a newborn and a huge amount of financial burden aside from being heartbroken. And over the course of that next year, he really slid into a very deep depression and started experiencing pretty significant substance abuse problems that he had not ever had before. And I mean, he's alive. He wound up in one of our programs, and it was just a tragedy as we think back about how many lives have been touched in direct and indirect ways. So I'm going to turn it over to Pat now, but I guess, there is opportunity, and I think we all have a serious responsibility in healthcare to rise to the challenge. Thank you so much.
So we've got a few questions today that have been submitted. Got a question here. With freestanding psychiatric hospitals being built in a number of service areas, how can my inpatient psychiatric unit inside our hospital compete with these newer and larger facilities?
Okay, I'll address that one. We are seeing activity, and I'm sure some of the members are by different psychiatric hospital companies. And what Signet does, almost all of our 80 plus partnerships are with community med-surg hospitals. So we know how to partner with the community med-surg hospital, and we can put up a building where it's warranted that can make sense, not only provide you new and exciting space for behavioral health programs, but it can also free up space in the med-surg hospital, which many hospitals find that as a benefit. So if you think there's an interest in that kind of expansion, please contact me. Thanks, Daniel.
I also wanted to just pipe in with it. One of the things that we market when we work in partnership with a member is that when there's a pavilion or a unit within your hospital, but attached in some way to your med-surg system, it really behooves being able to give a complexity of medical care to a population, adult as well as gero for sure, that has often a complexity of medical issues that that just can't happen the same way in a freestanding psychiatric facility that's on its own. So thank you.
Next question. It's been difficult for us to recruit psychiatric providers during sometimes. How does Signet assist with provider recruitment?
I'll take that one if that's okay. Gosh, I get asked this every single time as president that I go out on a sales call with one of our sales development VPs, and it's a very fair question. I don't have a magic wand. I wish I did. I don't have a doctor bus. I also wish I had that. But what I can say is that we've never, ever missed opening a program because we couldn't get a provider. It's just, this is what we've been doing our whole lives for most of us. And again, not that I have some magic wand, but it's our livelihood and we have a lot riding on it. We wouldn't have member partners if we weren't able to recruit providers. It's hard. We always recommend having a multifaceted approach from day one and being very aggressive about it with all of our resources, but so we get it done.
Next question. Let's see. How have Signet programs at hospitals dealt with psychiatric inpatients that contracted COVID-19 while on the inpatient psychiatric unit?
Goodness, I'm going to start and then see if any of my clinical VP colleagues have anything they want to add, since they're all nurses and I just play one on television. Basically, we work really our job is to be seamless. So when we work with a member partner, our job is to be seamless. So there isn't one cookie cutter answer. We looked at best practices though all over the country. One of the nice things that we do have is with having, 80 plus programs in over 30 states, we're able to really study and look at what best practices are and then share that information with our member partner chief nursing officers and liaisons and chief medical officers and physician providers across the country. So, we've had everything from units that were double rooms going down to single rooms, putting all kinds of testing into place before admission. I'll let them add, but there really wasn't one cookie cutter because we want to fit in, we want to provide best practices, but we're there to work in partnership, not to tell you how you have to run your hospital. If Pat or Karen or Tammy, if you want to add anything.
Yeah, thanks, Joy. One of the creative things that we did in one of our facilities in Connecticut was we actually set up zones within the unit. And so we had color-coded zones with green, yellow, and red that designated the COVID patients, those under suspect, and the patients that didn't have COVID. We definitely had different staff working in the different areas, and we were able to keep servicing our patients.
I just wanted to add that we work directly with the hospital infection control department and developed guidelines. And those guidelines, we made the practice to follow those guidelines, and we shared it among all of our units under Signet Healthcare.
Last question here is telehealth therapy more difficult when working with children and adolescents, and is it effective?
I'm going to take a shot at that one. It's very effective. I say all the time when I meet with chief medical officers and CNOs and CEOs, I said it last week sitting with Pat, actually. We were with a system somewhere. To me, it's always going to be the quality of your provider and your staff and how that's interactions are managed, as opposed to the form of how it's done, whether it's face-to-face or telehealth. Telehealth can work really, really well with children. I find, to be honest, children are very accepting of change. I will say even on our geriatric units, though, where I was a little skeptical at first, it's worked really, really well. And again, it's come down to, and certainly with adults as well, but I'm saying across all populations, and it really comes down to the quality of the provider, the equipment working, and the staff supporting it.
That is all of our questions. Thank you for attending today. And Pat, Doyle, did you have anything to close out?
No, once again, we really appreciate Vizient and Jenny Contreras helping us to sponsor this, and we look forward to talking with the members throughout the country.